Hey, Mandy,
Yeah.
can you take room 4? It's a musculoskeletal exam.
Oh, I suppose.
You owe me.
You're right, I do. And that's yours. Hello, are you Miss Negretti?
Yes.
Hi, I'm PA student Waters. I'm here to do your musculoskeletal exam today. Nice to meet you.
Nice to meet you.
I'm going to go ahead and wash my hands. Okay, I would normally obtain height, weight, temperature, take pulse and blood pressure in both arms and count respirations. Are you in any kind of pain today?
No.
Okay, if the patient was in pain, I would establish pain on a pain scale. Okay, I'm going to be doing your musculoskeletal portion of the exam. I'm going to start with just a general inspection. Can I have you put your hands on top of your knees? I'm inspecting for symmetrical joint alignment and any obvious abnormalities or deformities. Everything looks symmetrical. Okay, I'm going to continue with palpation. I'm starting with palpation of the upper extremities at the sternoclavicular joint, the clavicle, acromioclavicular joint, the scapula, the bicipital groove, and soft tissues, muscles of the shoulder girdle and upper arm, the medial and lateral epicondyles, the olecranon, soft tissues of the forearm, and soft tissues and joints of the hand, wrist, and fingers. Any pain with any of that at all?
No.
Okay. I do not feel any heat, tenderness, bogginess, or swelling over the bony prominences or joints, and muscles are symmetrical without spasm. Okay, I'm going to continue with range of motion of the upper extremities. I'm going to have you do a few exercises here. I want you to bring your arms up in front of you, all the way over your head, and back down behind you as far as you can. This time out beside you and up behind your head, and back down behind your back. Any pain with that at all?
No.
Okay, range of motion is full and pain-free. I'm going to do some muscle strength. I need you to bring your arms up in front of you. I want you to push out against my hands, pull in, push up, and pull down. Muscle strength is 5 out of 5 for the shoulders. I'm going to continue down with the elbows. Bring your arms up and back down, and this time bring them back up. I'm testing muscle strength of the elbows. Push against my hand. This time pull in and push against my hand. Good. Now I want you to bring your hands down. I'm going to have you twist your hands down and back up. Testing supination, pronation. Pain at all with that?
No.
Elbow range of motion is full and pain-free. Muscle strength is all 5 out of 5. Continuing with the wrists, hands, and fingers. So bring your hands out in front of you. Bend your wrists up. Hands down to the ground. Back to the middle. In. And bring them out. I want you to spread your fingers out. Bring your fingers in. Make a fist. And spread them all the way back out. I'm going to try and squeeze your thumb and pinky together. Don't let me squeeze it. Okay, and now I'm going to have you squeeze my fingers as hard as you can. Good. Any pain with that at all?
No.
Okay, I'm also going to test muscle strength of the wrist. Bring your hand up against mine and back down, down, and pull up. Okay, range of motion and muscle strength of the hands and fingers is full and pain-free. Muscle strength again, 5 out of 5. Continuing with the lower extremities, I'm going to palpate the bony prominences of the hip while the patient is standing. So I'm going to start with the prominent muscles of the thigh, bony prominences of the knees, and the patella. Soft tissues and bones of the lower leg. Feeling in the popliteal for any popliteal cysts. Okay, no cysts. Also feeling the medial and lateral malleoli, Achilles tendon, and the calcaneus, bones and soft tissues of the feet and toes. Again, no heat, tenderness, bogginess, or swelling over any of the joints and bony prominences. Muscles are symmetrical without spasm. We're going to do some range of motion with your toes and feet. I'm going to have you bring your toes out and squeeze them together. Okay, this time I want you to bring your feet up towards the ceiling and your toes down towards the floor. Good, and I want you to bring them in towards the middle and out towards the walls. Okay, I'm just going to invert and evert the feet. Any pain with any of that?
No.
Okay, range of motion, full and pain-free. And muscle strength of the toes. Can you push your toes up against my hand? And down, up, down. This time whole foot against my hand. And down, up, down. Okay, muscle strength 5 out of 5 for ankles and toes. And now we're going to do knee range motion. And have you bring your knees out as high as you can. And the other leg again.
I'm sorry.
Okay. I'm going to test flexion of the knee while the patient is lying down. So muscle strength. Push your knee out again, or foot out against my hand and pull in. And see. Pain at all with the knees?
No.
Okay. Range of motion is full and pain-free, muscle strength 5 out of 5. Okay, for the next portion of the exam, I need you to lie back. I'm going to be testing hips and also for flexion of the knees. So I need you to bring your knee all the way up towards your chest. And also feeling for crepitus in the knees. Pain with that at all?
No.
Okay. I need you to bring this foot over towards that wall as far as you can. And back out to this side. And same thing with the other leg. Either way works. Okay. Any pain with that?
No.
Okay, I'm going to test muscle strength of the hips. I want you to push your feet out against my hands and pull in. And push up against my hand. Okay, I'm also going to do passive range of motion, internal and external rotation of the hips. Just relax your leg. Okay, and then I just need you to lie over onto your stomach. And I need you to bring your leg up as high as you can without bending your knee. And the other leg. This time against my hand. Okay, hips are full range of motion. Any pain at all?
No.
Pain-free, muscle strength 5 out of 5. Okay, for the last portion of the exam, I need you to be standing, so you can go ahead and stand up. I'm going to have you stand right here facing the table. Okay, and I'm just going to be inspecting your back, so I need to lift your shirt up. Take 2. Okay, I'm going to be inspecting your hips. I'm going to be palpating the bony prominences of the anterior superior iliac spine, posterior superior iliac spine, and the greater trochanter. And inspecting the bones and soft tissue of the back, inspecting for any lordosis, kyphosis, or scoliosis. I'm also palpating all the soft tissues. Any tenderness at all?
No.
Okay, and the spinous processes. Okay, all symmetrically aligned. Okay, you can let your shirt go. We're going to do some range of motion now. I want you to turn a little bit to yours. Okay, I'm going to have you try and bend down and touch your toes. And now lean back as far as you can. And this time I want you to try and bring this shoulder down towards the ground. And the same thing on the other side. Okay, this time I want you to try and turn around and look at me without moving your hips at all. And same thing on the other side. Any pain at all with that?
No.
Okay, lumbar spine is full range of motion and pain-free. Okay, that completes the musculoskeletal exam. You can go ahead and put your shoes on.